increase quality of life changes even in the face of life challenges. They make healthy lifestyle choices. Symptoms, diseases, are opportunities to discover more about oneself and about the nature of one's life and what's possible. Vigorous healing is setting a standard for making effective change and actually creating progress in life. Dr. Kim Yost, editor-in-chief of the Journal of Alternative and Complementary Medicine, said, "There can be no doubt that we're witnessing the birth of a powerful method of healing grounded in rigorous scientific fact that will become integral to the future systems of health care." From an article, Reorganizational Healing, a Health Change Model Whose Time Has Come, as the guest editorial by Robert Blanks, PhD, in the Journal of Alternative and Complementary Medicine, Dr. Blank said this: "On rare occasions, one can step back and say, wow, that is a really good idea. Now might be that time." Reorganizational healing presents a radically new big picture view of health and healthcare that challenges the dominant disease care model of biomedicine. The government health tab has hit $4.6 trillion in 2020. The nation's healthcare tab was on track at $4.6 trillion in 2020, accounting for about $1 of every 5 in the economy. Along with rising costs, the reports found the share of healthcare tab paid by government keeps growing, approaching half of the total. This is not sustainable. Healthcare spending is projected to nearly double in the next decade. And really, what do we get for it? We don't get health care. We have disease care, where the whole objective, if it works, is to restore a person to a minimal state. If it works, it produces homeostasis. Homeostasis means stay the same. Homeostasis really only occurs in a closed system, not an interactive system. So if current health care works, as they have it now, and if a person is successfully treated, and assuming they don't die from treatment or aren't ill from treatment, then indeed, at best, the person should return to the prior state they were in, which actually promoted the conditions in the first place. Is there something that seems like it's challenged with this model? Dr. Julie Gerberding, former director of the Center for Disease Control, estimates the annual medical budget in the United States is $2.4 trillion in 2008. The overwhelming majority goes towards treatment of ill patients, and less than 5% goes towards keeping Americans healthy. Get this. Now, over 95% of the budget is in treatment of disease. That's a challenge. Nearly 1 in 2 Americans, 133 million, has a chronic medical condition defined as illness that are prolonged, do not resolve spontaneously, and are rarely cured completely. According to the Center for Disease Control, up to 40% of annual deaths from each of the 5 leading U.S. causes are preventable. 34% to the disease of the heart, 21% to the cases of cancer, the 33 cases of cerebral vascular diseases, 39 cases of chronic respiratory diseases, and 39% of unintentional injuries. Those numbers were actually preventable. During this presentation covering some statistics, and there'll be reference to the statistics, I suggest that you take a look at the World Health Organization and take a look at the statistics for your country. It's pretty sobering when you look at this. The World Health Organization states worldwide obesity has more than doubled since 1980. America leads that. In 2014, more than 1.9 billion adults 18 years or older were overweight. Of these, 600 million were obese. 39% of adults aged 18 and over were overweight in 2014, and 13% were obese. 42 million children under the age of 5 were overweight, obese in 2013. There is expected to be a 55% increase in global diabetes in 2035. Well, we're talking about number of people with diabetes in the region. In 2013, 37 million in America, 56 million in Europe, 138 million in the Western Pacific. Worldwide, 382 million people living with diabetes, and 46% will be diagnosed. An estimated 90% of seniors have at least one chronic disease, and 77% of them have two or more chronic diseases. Although chronic diseases are amongst the most common and costly health problems, accounting for almost 60% of the nation's medical costs, they're also mostly preventable. Of 17 developed nations, the U.S. rated dead last in death from all causes. Lots of people thought it was, just mostly because of the impoverished population or the underserved people. That's part of the picture. But Americans die more than any other nation in this group of 70 developed nations from alcohol, drugs, the worst rates of heart disease, lung disease, and obesity, and the highest rate of women dying from complications of pregnancy and of childbirth. In the last report the United Nations reported, and that was 1997 to 98, the U.S. ranked 15th of 19 countries on infant mortality. This is just not acceptable. The existing model of health care is not enough. The World Health Organization rated the United States healthcare system as the highest cost and responsiveness throughout the world, but ranks it as 37th in overall performance and 72nd amongst overall 191 nations surveyed in terms of overall health of its citizens. When we say the United States is rated as 72nd in its healthcare system, I want to just give you some countries that are above it. Turkey, Belize, Canada, Cuba, El Salvador, Australia, Israel, Azerbaijan, China, Slovenia, Mexico, Albania, Denmark, Sri Lanka, Panama, Kuwait, the former Yugoslav Republic of Macedonia, Bosnia, Argentina, and then the United States. Actually, Iraq is only listed as 3 countries below where America was as far as the health system performance in all member states, ranked by 8 measures. Reports prepared in 1998 and 2000 by Ontario health economist Pran Mangna, PhD, concluded the potential savings to Ontario's healthcare system as much as $380 to $770 million a year by implementing chiropractic. This extrapolated to a potential savings of $2 billion a year if implemented all across Canada. Nearly 7 out of 10 Americans were prescribed at least one drug in 2009. Half were given 2 or more, according to research from Mayo Clinic. Spending on prescription drugs in the U.S. reached $250 billion in 2009. Antibiotics, antidepressants, and opiates are the top 3. Abuse of tobacco, alcohol, illicit drugs is costly to our nation, exacting more than $700 billion annually in costs related to crime, lost work productivity, and health care. In 2012, an estimated 23.9 million Americans aged 12 or older, or 9.2% of the population, used illicit drug or abused a psychotherapeutic medication. This is up from 8.3% in 2002. The use of psychotropic drugs by adult Americans increased 22% from 2001 to 2010, with 1 in 5 adults now taking at least one psychotropic medication, according to industry data. In 2010, Americans spent more than $16 billion on antipsychotics, $11 billion on antidepressants, $7 billion on drugs to treat attention deficit activity. Estimates suggest that 20% of adults suffer from pain globally and 10% of newly diagnosed with pain every year. Pain in Europe revealed alarming results with regard to duration of chronic pain. On the average, adults surveyed suffered from pain for 7 years, but surprisingly, 21% of individuals experienced moderate to severe pain for more than 20 years. Achieving adequate pain control had taken more than 2 years and over 50% of the sufferers. With this, despite this level of suffering, many patients remained stoic, and almost half the individuals with chronic pain felt they have to tolerate at least a little bit more pain. 1 in 5 sufferers lost their job. 1 in 5 has been diagnosed with depression. 1 in 5 feels that sometimes they want to die because they suffer too much for the pain. Although we know what to do to be well, why is it we don't do what we know? Why can we not? Why can we not make the changes we need to make? Reorganizational healing was born from the research in network spinal analysis. It was born from the research at the University of California, Irvine. It was born to the fact that through network care, people made healthier choices. They were able to have more constructive change in their life. They physically got healthier, emotionally, mentally, socially. They had a better quality of life. And from the studies, research of the studies, and studying the actual nature of self-reported health and quality of life, and through the research and network, we came basically to the idea and the model of reorganizational healing. The journey to reorganizational healing is one everyone takes. And at some point, going back to where you were before is no longer an option. At some point, people say, enough of the treatment, I want to be well. I want to take my healthcare power back. Reorganizational healing is based upon the concept that there is a further or progression that's possible. You can go beyond. A friend of mine asked me about a friend of hers in the hospital. Her friend went into the hospital with a lump on the breast. They wound up doing a lumpectomy, doing radiation therapy and chemotherapy. During the treatment, her lungs were burned. And what happened is she had trouble with the lungs, and the chemotherapy, a problem with the liver. She developed a hospital-borne infection as a result of that, and they wanted to put her on a very intense antibiotic. So a friend asked me, should she do it? What should she do? And I said, well, what is your friend's objective? Just get healthy? She said, of course. I said, well, ask her, do you want to get healthy? And her friend said, yeah, I want to help my liver not be so sick, and I want my cancer to go away. I said, that's not being healthy, that's treating disease. Ask your friend if she wants to be well and what that means. She didn't even have an idea what well meant. She thought well means treatment of disease. Get this, there's no consistent relationship between treatment of disease and people being well. That's the catch. There's no consistent relationship between the size of a coronary artery and a person's angina symptoms. There's very little relationship between the size of a man's prostate and the urinary symptoms. There's very little relationship between the stuff going on and what happens, the symptoms a person has. There's just about no consistent relationship between herniation of disc and arthritis and pain. When life is in conflict, when the psychosocial factors and stress factors influence a person, then indeed they have more symptoms, because symptoms say, I need more energy, I cannot keep organizing this level of existence. Then go to a physician of any type, and the physician tries to name what deviates from average, and therefore that's blamed as a cause. And by treatment of disease, which is a means by which the body looks to reorganize itself, it doesn't get a person well, it just treats more disease. Now, sometimes treatment of disease can save a life. The reality is something different. The latest stats for the United Nations show about 101,000 people die in a year from preventable medical error. You're talking about what they report in the United Nations. In the United States is actually pretty low on the list of people getting through the system in a healthy way. So there's a real challenge. The more money that gets put into trying to restore people to a previous state and trying to get people to go to homeostasis and separating the person's health and their life from their disease, the more ill we get. It is a journey to reorganize. It's different than the path to restore. So what is your focus as a